We said preeclampsia, as you know. We said hypertension. Okay, that's greater than onset greater than 20 weeks. Onset greater than 20 weeks of gestation. Plus proteinuria, right? Okay, now let's grade the proteinuria. Then after that we'll look at the clinical types of preeclampsia. We'll look at the types of preeclampsia, okay? Because I told you the preeclampsia is progressive disease, so it progresses in stages. Grading of proteinuria, grading. Okay, so if you want to grade proteinuria, okay, there's a scale of grading, meaning with respect to the amount of proteins in the urine. You know, proteinuria can always be what? Gotten by a urine dipstick or a urine routine examination, okay? Now, there's a principle that we are going to use to grade, okay? So you remember, we are going to use only 1 and 3, okay? So you are going to have 1, 3, 1, 3, 1. So you should have 5, okay? 1, 3, 1, 3, 1, like a binary operation. So now, we are going to start from a decimal. When you say decimal, decimated, deci means what? Over 10. Are you following? So we'll take the first 2 figures, we'll do the decimal, then after that we'll revert, okay? So if we divide 1 by 10, it will give us what? 0.1, and the unit, gram per deciliter, okay? If we divide 3 by 10, what would they give you? Gram per deciliter. Now you go back and you do a reverse, okay? You divide it, so please multiply. So 0.1 times 10, it will give you 1. So we have 1 gram per deciliter. 0.3 multiplied by 10, 3. 1 multiplied by 10. So we are going to go in this order. If you have a value up to 0.1 gram per deciliter, we will see that that is trace proteinuria. Is that clear? Please, are we clear? If you have 0.3 gram per deciliter, we'll say that is 1 plus proteinuria. If we have 1 gram per deciliter, we'll say 2 plus proteinuria. If we have up to 3 gram per deciliter, 3 plus. And if we have up to 10 gram per deciliter, we'll say 4 plus. Is that clear? Another way you can write this is plus, 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 and what? Plus, 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 plus. Okay? Please, is that clear to you? Okay, so this is how you grade proteinuria. Okay? So, in trying to do this, if you look at the urine, okay, dipstick, there's a color coding incorporated into each function. So if you dip the urine dipstick into the urine and you wait for some time and observe, you are going to see a color change. Where the color change happens, it will be corresponding to a particular degree of proteinuria, a particular grade of proteinuria. Yes.
So what is, so we have 0 to 3 grams and 1 gram.
Which one?
Of 0.
Yes. So you have 0.1 gram per deciliter, 0.3 gram per deciliter, 1 gram per deciliter. So what this means is that from 0 to 0.1 gram per deciliter, above 0.1 gram per deciliter to 0.3 gram per deciliter, that will give 1 plus. Above 0.3 gram per deciliter to 1 gram per deciliter, that will give you what? 2 pluses. Above 1 gram per deciliter to 3 gram per deciliter, that will give you what? 3 pluses. Above 3 gram per deciliter to 10 gram per deciliter, that will give you what? 4 pluses. So you are looking at the upper borders. Please, are we clear? Are we clear? Yes. Just multiply. So when we got these values, we're just multiplying by 10. So 10 by this, 10 by this, then 10 by whatever you get. Yeah. Are you getting that? So that's where it ends. All right, that is fine. You should know that the grade of proteinuria proteinuria in general can be influenced by certain factors. Okay, it can be influenced by certain factors. the type of dipstick that you are using would matter. Okay, so proteinuria can be influenced by what? Certain factors. Okay, so if you have proteinuria, okay, in a non-pregnant woman, okay, proteinuria when a woman is not pregnant, okay, you can think of you can think of renal disease, you can think of what? UTI. You can also think of vaginal contamination. Contamination of what? Vaginal discharge. So you can have contamination. Okay. Sorry. Contamination of the urine by vaginal discharge and chlorhexidine preparation. If you are using a chlorhexidine to clean the vagina, yes, it could also precipitate proteinuria. Okay, so in a non-pregnant women, these are the things that you should be considering. Okay, are we following? But if you have a pregnant woman comes and depending on the gestational age, as we are saying, greater than 20 weeks, hypertension with proteinuria, you are thinking of pre-eclampsia. But in this case too, depending on how you do the dipstick, yes. Well, diabetes too can also. Diabetes, as if it's complicated diabetes, yes. It can also cause it, like diabetic nephropathy and all. But in diabetic nephropathy again, you will not see proteinuria. Why? Because it's microalbuminuria. So you will not be able to see it unless you do a urine albumin creatinine ratio. So that's the main reason why we are not even putting it here. Okay. So to give you microalbuminuria, which you cannot see. All right. Now, I told you the proteinuria, okay, whether it's present or not, can be influenced by certain factors. The first one is specific gravity of urine. Specific gravity. And the next one is pH. Okay? The pH. You should know. You should know that when we say specific gravity, what does it mean? You are looking at density of what? The urine over what? The density of water. Are we following? Specific gravity. Those of you who read integrated science, okay, which I know everybody should have read, you would come across what we call specific gravity. The physics aspect of science. Specific gravity, which is more like more of a relative density. Relative density of what? The substance over density of what? Water. So in this case, if the quantity of water is going high, what will happen to the specific gravity? It will decrease. If the quantity of water is going low, what will happen to the specific gravity? It will increase. So in this case, specific gravity, the normal can range from 1.005 or 1.1 to 1.030, okay? The normal. The normal can range like that, okay? Now, if you have a specific gravity less than, let's say 1.010, okay, we can consider it as a what? How will you think? It means that the levels are what? The level of water is what? High, right? So we can say it's a diluted urine. Is that not a diluted urine? And if you have this specific gravity of water less than 1.01 in the case of a diluted urine, then should you do a urine dipstick, you are going to have what? False what? False what? Negatives. You are going to have false negatives. Are we following? Then you should be asking yourself, what conditions can precipitate retention of water such that what? it will cause the specific gravity of the urine to be reduced. So what conditions can cause this? Yes, you can see renal failure because it's going to cause what? Retention of what? Water. Okay. What else? Can you think of? Yes, you can think of what? You can also think of glomerulonephritis. So we'll put them in one context. Okay, renal failure, glomerulonephritis, pyelonephritis. Okay. We can think of diabetes insipidus, which will cause the retention of what? Water. That will be the flow. Okay. Okay. More water. In this case, no. Diabetes insipidus. What's diabetes insipidus? More water will be flushed out, so no. So it will not be here. Because if more water is flushed out, no, hold on. No. If more water, yes, it is. If more water is flushed out, the urine that you are collecting, yes. But renal failure should not be here because there's going to be retention of water. Are we getting that? Because if you are saying renal failure, the urine will not be excreted. It will be retained rather. So whatever you are going to collect will be what? Concentrated. Are we getting that? So yes, for the causes, you can think of diabetes insipidus. Yes, what else can you think of? By syndrome of inappropriate ADA secretion, what will happen? There's going to be what? There's going to be retention. So it will give you what? Rather a concentrated urine. Are we getting that? Yes, what else can give us? Malignant hypertension. Yes, malignant hypertension. Yes, what else? Diuretics. Not necessarily. Yes. Yes, mostly from that, even though we are supposed to say 1.050, all right, 1.005, but mostly if it's less than 1.010, we are considering it as what? A diluted urine, okay? Yes.
What about posterior pituitary insufficiency?
Posterior and pituitary insufficiency. And in that case, what are you thinking of?
There's no ADH.
Yeah, that's what we are trying to say. If there's inappropriate secretion, so that's still SIADH. What else can we think of? Yes, psychogenic what? Polydipsia. Yes, psychogenic polydipsia. And also, pyelonephritis. Okay. When you say pyelonephritis, what do the renal failure? You are supposed to consider it in a way. If you say renal failure in this case, if there is renal failure, production of urine, would it happen? Renal failure. Would there be urine excretion? No, UTI, as I said, it will cause in a non-pregnant. Okay. Okay. UTI, okay. Yes. So here we can put pyelonephritis. Pyelonephritis, glomerulonephritis, yeah. And also, yes, also we can put renal failure. Why? Because there's going to be failure to concentrate the urine. Yes, that is the reason why it will happen. Failure of concentrate, because the kidneys are supposed to make sure they concentrate the urine. Are you following? So this will give us false negative. If you have a specific gravity of urine, okay, greater than 1.030, then it tells you that what? The urine is what? Concentrated. And if the urine is concentrated, It can give false positives. Then you'll be asking yourself, what can cause the urine to be concentrated? So causes, you can think of syndrome of inappropriate antidiuretic, syndrome of what? Inappropriate secretion of antidiuretic hormone. Okay, 1. You can also think of what? Congestive cardiac failure. 2. What else can you think of? Shock. Yes, if there's shock. What else? Yeah, hepatorenal syndrome. That is true. We spoke about hepatorenal syndrome here the last time. What else? Yes, yes. Dehydration, diarrhea. Yes, that is true. So you can talk about diarrhea, vomiting, dehydration. Yeah. So it tells you that if you have these things happening, your proteinuria could be what? Positive, falsely, or it could be what? A false negative. So false negative is usually associated with diluted urine, where the specific gravity of water is specific gravity of urine is less than 1.01, 1.010, or 1.005. Okay, then you are going to have a false negative, and we made mention of what? The condition like psychogenic polydipsia. We made mention of pyelonephritis, glomerulonephritis, renal failure. We made mention of malignant hypertension. We made mention of that, and also diabetes insipidus. Diabetes insipidus. Yes. So in that case, that's the main reason why early morning urine should not be used for the testing. We do not use early morning urine because it will definitely have proteins in there. So early morning urine is not to be used. Please really understand that. Because if you use early morning urine, you will have a false positive. Yes. Alright, that's fine. So this is for the grading, as we said. So in that case, if you are using a urine dipstick, you may have false positive and false negative. Because of that, there has been a special type of the dipstick, we call it the multi-stage reagent. So you should use a urine dipstick with what? Multi-stage reagents, okay, to reduce the incidence of false positive and false negative. Why? Because the multi-stage reagent, okay, it takes into consideration the pH, which is very, very important. It gives you the pH, okay, and also the specific gravity of water. Yes, the pH especially, to consider that. Because if it's an acidic medium, you know what can happen. If it is, you know, do you understand the relationship between albumins and acidity or basicity? Do you know that? That if albumins are being excreted massively, what will happen to the pH of this? What will happen to the pH? Albumins, what do they do? Albumins. Oh, albumin. Albumin is a protein. It draws fluid. No, I mean with the pH. Albumin, what's albumin? It's a protein. Proteins are made up of, what's the basic unit of proteins? Amino acid. So if albumins are being lost, what will happen to the pH? It will increase. Then we will say that there's what? It's what? The blood will become more basic, right? But if, yes?
Because it draws more fluid, definitely acidity is going to...
You know, acidity or basicity does not have to do with the loss of fluids. It has to do with the loss of what? H plus or hydroxy ions or hydrozonium ions or hydrogen ions. Are you getting that? So proteins, think about albumin. Albumin, what does it? What is it made up of? Are you getting that? All right, that's fine. Let's move on.